Can a thermometer test really indicate a thyroid problem? In this video, I'll discuss 8 signs of thyroid issues when you should be concerned and why you might need to seek help for a potential thyroid problem. I'll be focusing on 2 main scenarios. First, hypothyroidism, which is the most common thyroid hormone imbalance, where there's a reduction or lack of thyroid hormones occurring when the thyroid can't produce hormones properly. I'll also cover signs of hyperthyroidism, which involves an excess of thyroid hormones. Additionally, I'll explain thyroid tests. What's the best test for detecting these hormonal changes, and what results should you expect? I'll cover all of this in the video, along with debunking several myths throughout. What about this thermometer test you might have heard of? If you're curious, there are various viral videos circulating online about this thermometer test. What exactly is it, and why is it misleading? The thermometer test is simply taking your body temperature measurements when you wake up, and then you calculate an average which supposedly would diagnose thyroid issues. But that's a complete myth, okay? So be very careful with this kind of information. This method isn't reliable for detecting thyroid problems like hypothyroidism, for example. Got it? So here's our first myth debunked. Let's move on to the real signs and symptoms. Now that you know not to believe some of the nonsense circulating on the internet like the thermometer test, the first sign that might actually indicate your thyroid needs attention or has a problem is a change in heart rate. And I mentioned I'd explain about both hyperthyroidism and hypothyroidism as well. So what happens when you have an excess of thyroid hormones? Your heart rate increases. This is called tachycardia. It's when your heart beats faster than 100 beats per minute. And this isn't about when you're doing physical activity or running. We're talking about heart rates higher than 100 beats per minute at rest. You're sitting or working and your heart is racing. In that case, we need to check your thyroid. The thyroid is important because the heart has receptors for thyroid hormones. When these hormones are excessive in our blood, it can lead to tachycardia or accelerated heartbeat. The opposite is also true for hypothyroidism. When there's a lack of thyroid hormones, the heart might beat more slowly. It can slow down significantly. We're looking at heart rates below 60 beats per minute. I want to highlight that a decrease in your normal pattern is also noteworthy. For instance, if you usually measured your heart rate and it was consistently around 90 or 95, but now it's starting to be at the lower end, like 60 or 65, and you haven't made any changes, you haven't started taking any new medications, such as beta blockers, for example, which can cause a reduction in heart rate. If there's no new medication, but you're seeing this reduction in heart rate, even if it's within the normal range of 60 or slightly above, that's worth noting. If it was previously at the upper limit, that's also a warning sign, okay? Often, during the first consultation, before the patient has even had any tests, I always count their beats per minute. And frequently in hypothyroidism, this count is lower than normal. Heartbeats around 50, 55. So pay close attention because this can lead to serious problems. And for those who are already predisposed, for example, this can be a very serious sign. So normal heart rate ranges from 60 to 100 beats per minute. Number 2, changes in bowel movements. And this is really important because you should discuss it with your doctor. For instance, if you used to go to the bathroom every 1 or 2 days and now you're having bowel movements 3 times a day, that's a warning sign. An increase in bowel frequency can be a sign of hyperthyroidism, too much thyroid hormone, and the opposite is true for hypothyroidism, where there's a greater tendency towards constipation. You used to go to the bathroom every day, but now you're only going once every 3 or 4 days without any changes in your diet. You haven't stopped eating fiber, for instance. If you can't explain this change, we also need to investigate thyroid-related symptoms, especially when it comes to changes in bowel movements. There are other intestinal symptoms, but I'm focusing on this one because it's easy for you to notice. And sign number 3, which is often a subject of controversy and much discussion, is whether thyroid issues can cause weight gain or weight loss due to hormonal changes. And the answer is yes. In hyperthyroidism, you can experience a significant weight reduction, about 15% to 20%. So, a person who weighed 100 kilos, for example, with hyperthyroidism without any dieting, could drop to 80 or even 75 kilos. That's a very noticeable weight loss. It's one of the warning signs for hyperthyroidism. In cases of unexplained weight loss, it's crucial to evaluate thyroid function to prevent extreme situations. This type of weight reduction isn't beneficial for your health. You lose significant muscle mass, which is detrimental to your metabolism. For those thinking, oh, so hyperthyroidism would be good for weight loss. Well, it's not, okay? Because you'll lose a lot of muscle mass and feel terrible as well. So this kind of weight loss or reduction isn't beneficial at all. What about hypothyroidism? Can we blame the thyroid for weight gain? This is a highly debated topic. The answer is yes, but the change is less dramatic. With hypothyroidism, as I explained, a person can lose up to 20 or 25 kilos, depending on the case. In hypothyroidism, the average weight gain is around 2 to 4 kilos. This varies greatly depending on the severity of the hypothyroidism. I've seen several cases where the weight gain was more significant. This is due to two reasons. First, you can become very bloated due to fluid retention, which I'll explain more about. Second, your basal metabolic rate, the energy your body expends at rest, also decreases. So it's another factor, along with other issues like feeling less energetic and more tired, which leads to less physical activity and lower energy expenditure. So yes, this isn't a myth. It really does happen. But you might be wondering, why do so many people say thyroid problems don't cause weight gain? You're probably thinking about that too. Well, once you're undergoing treatment and your blood levels are normal, along with other tests, any weight changes can't be blamed on thyroid issues. Here, I'm talking about the initial diagnosis when the person isn't on any treatment yet. So that's the reason. Number 4, mood changes. I want to highlight that in hyperthyroidism, a person can become more anxious or their existing anxiety can worsen. A person can experience more episodes due to increased heart rate and they become more sensitive as well. So it's important to pay attention to this. If you're experiencing anxiety attacks, it's also necessary to evaluate your thyroid function. On the flip side, with hypothyroidism, we can also see mood changes, including a predisposition to depression. This is because thyroid hormones also affect our central nervous system. So it's crucial to assess thyroid function in these cases too. If you're enjoying the video so far, I'd like to ask you to give it a like. Let's aim for a goal of 8,000 likes. If you're not already subscribed, please do so and start following our content. Now let's move on to the signs and symptoms. Sign number 6 is changes in memory, and this applies to both conditions. This is an uncommon sign. Both in hypothyroidism and hyperthyroidism, hormonal changes can affect memory. In fact, there are cases where a person wasn't diagnosed in the early stages, which can lead to a long delay and may even cause dementia. So this is definitely not something to take lightly. And sign number 7 is swelling. Swelling is a more prominent characteristic of hypothyroidism, not just in the lower limbs, legs and ankles, but it can also occur in other parts of the body, like the face. I don't know if you noticed the thumbnail of this video where the face looked more swollen. This can happen due to the hormonal changes, specifically the reduction of hormones. Swelling in hyperthyroidism is less common, but for item number 7, I'll also mention changes in the eyes. Take a look at this photo. In hyperthyroidism, you can have this condition called Graves' ophthalmopathy. This change is notable because of what's known as exophthalmos. The eyes can appear more bulging, but that's not all. There can be other changes too, such as what's called hyperemia. The eyes may become redder and start to water. I want you to know that if you notice these symptoms early on, starting treatment right away is much more effective. Your chances of responding well to treatment are much higher when caught early. So pay attention. If you notice changes in your eyes, you should also get your thyroid checked to rule out hyperthyroidism. And sign number 8, which is very important, and I want to emphasize here, is that thyroid hormone imbalances can cause high blood pressure. I see many people who are being treated for high blood pressure, taking various medications, but nothing seems to work. In reality, they often have a hormonal imbalance in their thyroid. The response to blood pressure treatment will be very difficult and complicated until the hormone levels are corrected. Normalizing blood pressure won't be possible. So if you have high blood pressure, you also need to evaluate your hormone levels. This can happen at both extremes, in hypothyroidism and also in hyperthyroidism. Generally, in hyperthyroidism, we have what's called systolic hypertension. What is that? The first number can increase more. For example, 160/80. Do you see how these numbers are further apart? This can happen when there's an excess of thyroid hormones. In hypothyroidism, a condition called diastolic hypertension can occur. That's when the second number, the diastolic pressure, gets closer to the first number. You might have heard something like this before. Oh, it seems like my blood pressure numbers were getting close together. The doctor said that's not a good sign, and it really isn't. For example, a blood pressure of 130/100. The bottom number of 100 already indicates high blood pressure. So it's always important to evaluate thyroid hormones. Now, what are the best tests to detect thyroid problems? You've probably seen those thermometer tests, but let me tell you, they're all nonsense. Diagnosing thyroid issues is based on symptoms, but also on blood tests. The main tests are TSH, thyroid stimulating hormone, and free T. These are the two primary tests used initially for screening. Depending on the results, other tests might be needed, such as autoantibody tests like anti-TPO, TRAb, or antithyroglobulin, as well as imaging tests like ultrasound or scintigraphy, or even free T. The doctor can assess whether these tests are necessary. But the two I want to highlight here are TSH and free T. And how will they appear in each situation? In hyperthyroidism, we'll see a reduced TSH, often as low as 0.01, along with an increased free T. Why am I mentioning many hormones while TSH is reduced? Because the brain, specifically the pituitary gland, detects this increase in free T4 and other hormones like T3, and consequently reduces the hormone that stimulates the thyroid. So TSH will be low in hyperthyroidism. In hypothyroidism, TSH will be elevated and free T4 will be reduced. Here I'm talking about thyroid gland disorders. In other cases, you might encounter unique situations such as subclinical hypothyroidism. Have you heard of this term before? It's when TSH is elevated, but the free T4 hormone is still within normal range. This change didn't actually occur, which is why it's called subclinical. The same applies to subclinical hyperthyroidism. Changes in TSH with normal thyroid hormones, as well as disorders of the pituitary gland and hypothalamus, can also cause abnormalities in these tests. But that's getting into very specific territory. It would be more of a topic for endocrinologists. If you're interested, I could make a video just about this and explain every detail of these rarer conditions. So let me know in the comments if you'd like to see that video. Also, give it a rating from 0 to 10. If it gets a 10, I'll make more videos like this one. Now, I'm going to leave you with a suggestion for another video to watch. It's a video where I talked about the worst things for your thyroid. What can really harm your thyroid amidst so many myths? What should you believe? In that video, I included a lot of scientific information about the thyroid. I'm sure you'll enjoy it and find it useful too. Take care. See you next time.